Wonderful. I think we've reached critical mass, so we can go ahead and get started. Again, we appreciate you taking the time out of your afternoon to join us to discuss an overview of the upcoming 2026-28 Triennial Child Count requirements for your Child Care and Development Fund program. Thank you all for introducing yourself as well. It's good to see you all virtually. And we hope today that you will walk away with a better understanding of the child care child count requirements, that is. If you have questions along the way, feel free to plug them in the chat box or raise your hand and come off mute. We're happy to answer the questions that we are able to today and or take them back and provide a follow-up response later. A copy of the slides today will be sent out to everyone that registered, as well as a link to the recording of today's training. So you will have access to these. These will also be posted on our Technical Assistance Partners website. And we have links and QR codes directing you in that way all throughout the presentation today. Also, just to flag that this is being recorded again, and a link will be sent out for that recording. Nyala Scannell, Sarah Stafford, Nick Gayasso. I am a senior tribal specialist with the Office of Child Care. I am joining you today from Tacoma, Washington, which is also the ancestral and contemporary lands of the Puyallup tribal people. I myself am affiliated with the Seneca Nation of Indians, and I have been with OCC for a number of years, both in the regional office and now working out of our central office. So really good to connect with you all today. And next, we can go ahead and switch slides. I will hand this over to Meryl.
Thank you, Sarah. Hello, everyone. My name is Meryl Borofsky. I'm a senior program specialist in the Office of Child Care in our Division of Program Operations. And today I'm calling in from Harvest, Alabama, the traditional homelands of Cherokee and Chickasaw tribal nations. I will pass it over to Melody.
It's good to see everyone today. I'm Melody Redbird Post. I'm the project director of the Tribal Child Care Capacity Building Center, and I currently reside on the traditional and contemporary homelands of the Kiowa, Comanche, and Apache nations in western Oklahoma. And I will turn this over to my colleague, Selena.
Hello, good greetings to each one of you. I'd like to introduce myself. My name is Selena Curley. I am the tribal subject matter expert for subsidy administration. I am with the team from Tribal Child Care Capacity Building Center.
Thank you all, and thank you to the team that pulled today's content together. So let's go ahead and go to the next slide. So first, before we jumped into the child count content, we wanted to flag a couple of really important deadlines and dates coming up from the Office of Child Care. First, if you are subscribed to our OCC announcements, you may have seen that we released a new program instruction covering how tribal lead agencies can request fiscal waivers as well as transitional waivers to cover the new copay requirements. You'll see in particular that any fiscal waiver requests are due by the end of this month. If you have any specific questions and you're a direct funded lead agency, please reach out to your regional office for support. That first QR code will take you to our website where you can get a copy of the program instruction. And again, if you are subscribed to OCC announcements, you will have seen that announcement came out last week, and a direct link to that website is also provided there. Next, we are hosting a formal tribal consultation for tribal leaders this Thursday covering the new notice of proposed rulemaking, which covers income eligibility requirements for tribes with medium and large allocations. The second QR code in purple that you see will take you to the registration site for that. A Dear Tribal Leader letter went out almost 30 days ago with all of the relevant information. We appreciate CCDF administrators and other CCDF staff who have been working with your tribal leaders to prepare testimony for this consultation. And lastly, we wanted to share that the upcoming fiscal year 2026-2028 CCDF plan is published and the public comment period is open. We're very interested in hearing your feedback on this preprint, which is due next July 1st, 2025, and incorporating any proposed revisions or changes that would help streamline the process for submission and filling that out. In particular, that QR code also takes you to the website that gives you instructions on how to submit a public comment as well. Okay, let's go ahead and go to the next slide. So today, we are going to review the purpose and the impacts of what a CCDF child count is, highlight changes that those of you who participated in any previous child counts will see between this cycle and previous cycles, review the requirements included in the new child count, review some strategies for conducting your count. There are some relevant resources that we hope will be very helpful for you as you begin the process of collecting data and refining your definitions, and also review some next steps and future webinars and resources that are yet to come to support you through this process. Next slide. So we're going to dive deeper into all of the components that are listed on this slide, but we did want to share at a very high level that for any tribe that wants to receive CCDF funds over the next 3-year cycle are required to submit a child count to the Office of Child Care every 3 years. And it is a self-certified number of the amount of Indian children that are under the age of 13 that are residing within your self-defined service area. And this count is used as the basis for the CCDF funding that each tribal nation or tribal lead agency receives every federal fiscal year in conjunction with the amount that is appropriated by Congress and then set aside specifically for tribes. So for direct funded tribal lead agencies, the count or the submission includes your definition of Indian child and your definition of your CCDF service area. Tribes have broad flexibility in determining the methodology and the data sources used for the count, as well as defining what each of those terms are. And then we did want to flag, and again, we'll go into more detail later today on what these terms mean, but tribes are required to confer or work with both overlapping and or neighboring CCDF service areas and ensure that there is an unduplicated count of children in their submission. Changes to your child count submission once finalized through this process that will take place next summer cannot be changed during the 3-year cycle, except if there's a new tribal nation or lead agency as a new grantee comes in, and or if there's a consortium member change within that 3-year cycle. So there's very limited circumstances where a child count number can be changed after it is accepted by the Office of Child Care. With that, wanted to pause and see if there are any questions before I hand this over to Meryl. If not, Meryl, you can go ahead and jump in.
Thanks, Sarah. I'm just going to pause as we go to the next slide. But as Sarah said, please feel free as we talk. We'll pause if you have any questions, but please raise your hand or drop them in the chat and we'll pause to make sure everything is clear. So if we can go to the next slide. The next one, please. Thank you. First, I'm going to kind of talk a little bit about what has changed in the child count since the last round. But I wanted to pause for a moment and recognize that the Oops, I will pause for a moment I see a hand up. Julia,
Hi.
do you have a question?
Yeah, Sarah said that the child count can't change, but can you change the definitions of your Indian child?
Great
Doesn't
question.
change your
Yes,
count.
you can change your definition of Indian child or service area, but the number of which is related, and we'll talk about which is related to eligibility, but the actual number cannot change.
Okay.
Sarah, did you want to add anything?
Yeah, I just want to clarify too. It could be expanded upon, but it can't be narrowed because you're receiving funding based on your original submission. So for instance, if you are choosing to define all Native children, including descendants of federally recognized tribal citizens, in your original submission, your number may be very large, but then you want to narrow it to just enrolled citizens of your nation in particular, that number is likely a lot smaller. So you can't narrow it, but there's an opportunity potentially to expand it. And so that would be the same for your service area as well. So it's best to reach out to your regional office to discuss any kind of changes that you're thinking about to kind of walk through the implications of that.
Okay. So before we talk a little bit about some of the changes that were made, we wanted to acknowledge the fact that the program instruction for this child count was released a year before the due date of the child count. This was very intentional on OCC's part and in response to comments that we received over the past year on our request for information. We heard loud and clear from tribal nations that they needed the instructions, the final questions, and targeted and intentional TA early and often on the child count. And so I'll highlight some changes that we made, but they are pretty minor because in order to get this out a year early, we couldn't make substantial changes. And so we hope this will allow you all to have more time to conduct your child count, to get TA, talking to your regional offices or TCBC, and just more time to really think through the child count. This is the first in a series of webinars, and TCBC will talk about all the other supports that they have planned, but we really hope that putting this out early will be beneficial to you all. So if you have looked at the program instruction or PI, you'll see that there's really few changes. We did change the structure, just trying to clarify things a little bit. The other kind of big thing that we wanted to note that we changed was in the last program instruction, there was an instruction to complete the child count kind of in the year before it was due. And instead, we've replaced that with the language, tribal lead agencies are encouraged to select data sources that provide the most valid, reliable, and timely counts. So there's not necessarily a restriction of that 1 year, but really hoping that you find a data source that is timely, but also meets your needs and is the best that you have. We also changed just, it used to say reservation or service area, it's just service area, because as we will talk about, service area is on or near reservation. Also, just for clarity's sake, we tried to separate the instructions and make it really clear what's required for direct funded tribal lead agencies and those that have consolidated their plan into 102477 program. We also have a specific section for consortia, hopefully just to clarify what is required for consortia on the child count. CARS is not open. That will be the Child Care Automated Reporting System. That will be where you submit your child count, but we hope that it'll open early in calendar year 2025, a good 6 to 7 months early, so you can start submitting as soon as you can. Go to the next slide. Thank you. 3 other kind of quick changes. So tribal lead agencies that are not consortia do not need to upload any documentation into CARS. You will just answer all of the questions in the document. You won't have to upload any signed documentation like you've done in previous rounds. Tribal lead agencies that are consortia will have to upload one document per member tribe. This is a change from the last round where you've had to upload 2 documents per member tribe. And so hopefully this really eases some of the burden. And we have 2 samples that you can use if you'd like as appendices to the questions document, which we'll link to in a moment. One is an example for direct funded tribal lead agencies, and one is a sample for 102477 lead agencies. And then finally, one change we made for 102477 lead agencies. In the past, there has been a question on that form that was uploaded asking if tribal lead agencies wanted to request reallocated funds if available. We've now just, since you don't have to upload a document, have just put that as a checkbox into CARS. As a reminder for direct funded tribal lead agencies, you answer this question annually when you submit your 696T form, but this is how we get the information from 102477 tribal lead agencies. I want to pause for a moment to see if anybody has any questions about any of those changes.
Hello.
Okay.
I am
Yeah.
very new to CCDF. So the PL 102477 plan, what does that PL stand for?
Sorry, it's public law.
Public law. Okay. And how would we find out which way we are? Is it just we just read it in our plan, or because I'm absolutely starting from scratch and learning everything. So I'm a director from a childcare center that got promoted up. So everything's very, very new to me.
Yes, that is a great question. We can reach out, and like your regional office would be able to tell you. It's a separate. Tribes who have CCDF would kind of apply for this consolidated plan, and you would. It's very we can support you through that. It's pretty easy for us, so we can let you know. And then it is a different plan, and there are slightly different requirements for the child count, but we can help you with that.
Okay, all right, thank you.
Okay, I'm gonna keep going, but please, if you all have any other questions. Or Sarah, did you want to say something?
Yeah, I just wanted to note that Charlene Big Knife in the chat box, I think, raised the hand, so I just want to see if they want to come off mute.
Oh, yeah.
Yeah, it's actually Darla. I'm just using Charlene's computer. So if we use the enrollment, through our here for the child count. So we have like surrounding schools like Big Sandy, that's not like 10 miles from the reservation, and those kids are in that count, but they go to school there. Can we count them?
So that is a great question. Sarah, do you want to take it, or do you want me to?
Sure. I would say this is a really good question for your regional office to walk through with you. I think a little bit more information might be needed to give you the correct answer. But generally speaking, if you have schools or neighboring cities that are in close geographic proximity to your reservation, you can include the children that reside there. So we'll talk a little bit more about both the definition of Indian child and service area parameters later, and it might help answer your question, but definitely please do reach out to your regional office to help walk through your certain circumstance.
Thanks, Sarah. Can we go to the next slide, please? And the next one. I will now kind of provide an overview, just like generally what is required. And we are going to also provide some examples that we pulled from last round child counts that'll hopefully also help you, because this is a lot. It's, you know, especially if you haven't done this before or even remembering from a couple of years ago. So the definitions of Indian child and service area are included with the child count submission for direct funded tribal lead agencies. Tribal lead agencies have the flexibility in whether they define their service area as just on the reservation or on or near the reservation. And it is not defined what near means, but it needs to be within a reasonably close geographic proximity to the borders of a tribe's reservation, except for tribes in Alaska, California, and Oklahoma. And I would say, like Sarah, really reaching out to your regional program specialist or TCBC with support to this, especially if you are in one of those 3 states that I just mentioned. We can go to the next slide. Okay. If your tribal lead agency has consolidated their funds into an approved 102477 plan, that 102477 plan might be on a different cycle than direct funded tribal lead agencies, which are all on our 3-year cycle. You still need to submit your child count July 1, 2025. Definitions of Indian child and service area are included in that approved plan, so you don't need to resubmit that to the Office of Child Care, but you must use that definition when you're doing your child count. So if you said your definition is only children who are citizens of your tribal nation, in your child count definition in your approved plan, you have to use that definition when you are counting children for the child count. However, you might be doing your child count and realize, hey, we'd like to change our definition for this child count. You'd need to submit an amendment for your 102477 plan to change that definition. So you certainly can, as you're working on your child count, change that definition. You would just have to do it through an amendment and not through this child count process. Just checking my notes. Does anybody have any other questions? Does that kind of make sense? Okay, can we go to the next slide, please? Okay, so tribal lead agencies that are consortia also need to submit a child count as part of this process. Any tribe can join a consortia. I apologize, there's a little bit, if you can hear it in the background right here. So any tribe can join a consortia. A tribe with fewer than 50 children under 13 may also participate in a consortia if a consortia is available. And each consortium must demonstrate authorization from each participating tribe, which includes a signed declaration that the consortia can act and receive CCDF funding on their behalf. And this signed declaration is required both upon joining or creating a consortia, as well as every 3 years. You go to the next slide, please. So first of all, a consortia lead agency must demonstrate that they have the managerial, technical, and administrative staff with the ability to administer funds, manage a CCDF program, and comply with the provisions of the CCDBG Act and regulations. So that's just broadly. But in terms of the child count, the consortium lead agency has to submit a child count for each member tribe. And this is what I talked about before, that document that will need to be uploaded. In this document, each member tribe needs to include the individual child count for that tribe, their definition of Indian child. This could be the same across all the member tribes in a consortium. You can decide, amongst member tribes, you want to have the same definition, or it could be different. It's really up to you. It's up to your member tribe. And then additionally, each tribe has to have a definition of their service area. The same kind of rules apply for consortia member tribes that they do for tribal lead agencies. The member tribes with overlapping or neighboring service areas must confer with each other just to make sure that there's not children being double counted. So we need to ensure that there's an unduplicated count of children. And as I mentioned, we have examples of that letter that you could use if you would like. Although that is not required, you could use a different letter if you choose. I'm going to pause. I think that's a good place to pause for a moment. Okay, let's go to the next slide, please. Okay, so there are a couple special rules for Indian tribes in Alaska in terms of the child count. So tribal mandatory funds are only available for the Metlakatla Indian community of the Annette Islands Reserve and the 12 Alaska Native regional nonprofit corporations listed in Section 418 of the Social Security Act. The 13 authorized entities may receive tribal mandatory funds on behalf of Alaska Native villages in their region. These Alaska Native villages may receive discretionary funds either directly or through one of the 13 authorized entities designated to receive tribal mandatory funds. The 13 authorized entities must submit 2 child counts, one for discretionary and one for tribal mandatory. And I will say, if you are not an Alaska village if you are not an Alaskan village, you can just ignore everything I just said. And if you are and you have questions, please reach out to Region 10 because they can really help you through this. But there's just a little bit extra with the 2 child counts that you might have to do. We can go to the next slide. Thank you. So we've said this before, and I think we say it a couple more times in this webinar, but just a reminder that the child count for everybody is due in CARS, July 1, 2025. As soon as CARS is open, we will do a training on how to actually submit it in CARS. But we just want you to circle that in your calendar as the due date. So we can go to the next slide. Okay. These are the last 2, and then Sarah's going to get into some examples. So here is another QR code. This is to the program instruction, which I walked through. It is very much a technical document. It is really useful, so you can see all the requirements. And hopefully it's a little bit clearer than those in the past. We can go to the next slide. We also created as kind of an appendix of the program instruction, a document that just has the child count questions. We structured this how we think it will look in CARS. CARS is not final, it's not built yet. So I think this is what it'll look like, but hopefully that'll also be helpful for you. As you're filling it out in CARS, you have kind of the document of what it'll look like. And in that document at the very end, you'll see the 2 appendices, which are the sample letters. And with that, I think I'm passing it to Sarah, but also pausing to see if anybody has any questions.
Great. Thank you, Meryl. We can go to the next slide. So next, we're going to dive a little bit deeper on how to approach conducting your child count. Let's go to the next slide. So as we have alluded to, there are potentially a lot of steps to approaching how to conduct your child count. But some of the first ones that folks will need to consider is, do you want to make changes to your definition of Indian child and or service area for this cycle, or is it worth revisiting, looking at those definitions and whether or not it's meeting the childcare needs of your Indigenous children and families in your surrounding areas? So You can either start with looking at your definition of service area and or your definition of Indian child, or look at them together. But one critical piece that you will have to also consider is identifying available and existing data sources that are valid and reliable as well. And really consider whether or not those data sources support your definition of service area and your definition of Indian child, and if not, what other data sources best align with that? Are you going to consider multiple data sources for certain areas of your surface area and or for particular age groups for your service area? So there are a lot of different components to take a look at and consider, and also think about who within your tribal lead agency or larger tribal administrative team, maybe even tribal leadership, that you need to connect with and have these discussions with. For those that have either neighboring and or overlapping CCDF service areas, overlapping service areas are definitely allowed, but it is critical that you work with them, again, in ensuring that you understand what each other's definitions of Indian child are, what each other's definition of service areas are, how much they overlap, and or, again, the requirement is to confer even if they are just neighboring and they're not touching or overlapping anywhere as well. And we understand that that process can also be a political process where each tribal leaders may need to be involved and support a formal agreement for CCDF services. I would say, I think over 95% of all federally recognized tribes receive CCDF funds. So we do know that, especially those that are within close proximity to each other, this conferring piece can take a while. And we are hoping that since the program instruction is released, it will support you all in your efforts in working with neighboring nations. And lastly, after all of those different considerations are decided upon, the ultimate goal or end point will be submitting your child count in CARS and then going through the final approval process through the Office of Child Care. Okay, next slide. So because the child count is the foundation for CCDF funding and also the foundation for CCDF eligibility for Native children and families, it's really important for tribal lead agencies to have written policies and procedures detailing how you all approach your child count process, so that anybody that wants to learn about it and or you need to demonstrate how you conducted it and ensure non-duplication and everything else that aligns with the program instruction requirements, you can show that. And we also understand that from time to time, tribal lead agencies have new staff that come on board maybe after the child count was submitted, but really needs to understand for the future how to either approach it in the same way and or make improvements from the last time that it was submitted. So we highly encourage written policies and procedures for this whole process. If you need support with that, that is something that we can offer technical assistance around. So please do reach out to your regional office if that is a need of yours. So we've been talking too about different approaches or methodologies for how you go about collecting the information for your child count. So this could include the process for requesting different data, considering multiple data sources, again, ensuring that whatever data source you use aligns with your definition of Indian child. Any kind of calculating that you need to do to either remove children from your child count. Let's just say if the data source that you have is more encompassing than your defined service area. Any methods that you use in collaboration with neighboring and overlapping service areas to make sure that you're not duplicating the same amount of children in your count is important. Whatever your internal process for ensuring that your calculations and your submission has been vetted through the proper channels at the tribal level is really important. And instructions on how to submit the child count in CARS might be something really helpful to have written on your end. Okay, Next slide. So next we're going to dive into the parameters for the definitions of Indian child and service area. So tribal nations have broad flexibility in defining. Yes.
Sorry, we have a question that came up in the chat. The question, would a service area-wide survey be logical to gather information as well be logical?
So that's a good question. So OCC doesn't limit what data sources that you use. You just want to ensure that it's valid and reliable. So that could be an approach. A consideration is, if you do that survey, are you going to also use other data sources? And if you do, how do you ensure that they're not duplicating the same populations that you're collecting for the various data sources? So again, I encourage you to reach out to your regional office to share a little bit more about what that survey might include or your approaches there, and they can help walk through any implications. Any other questions? Okay. So tribal nations have broad flexibility in defining what an Indian child is, as long as that child isn't affiliated with a federally recognized tribe. So an example of a very broad definition of Indian child could be any enrolled citizen of, descendant of, and or who is eligible to be a descendant of any federally recognized tribe. And on the next few slides, we'll show you actual examples from different tribes with some identifiable information removed to offer as examples of the wide variety and spectrum of definitions of Indian child that folks can use and do use. So let's go to the next slide. So I just shared a really expansive definition of Indian child, and probably the most narrow definition would be just serving the citizens of a particular tribe, which again, you have the discretion to do. Another example is this tribe said that they would serve any child who is age eligible and an enrolled member of this particular tribe, or a non-native child that lives within a native household. So it could include stepchildren, adopted children, foster children, living within a native household. So that's a pretty unique approach, but also allowable. And then the next example is any native child that is enrolled or has at least a grandparent enrolled in any federally recognized tribe. So they recognize citizens and then also descendants to the second degree. And then the fourth example here is a child who is an enrolled citizen, direct descendant, second or third degree generation descendant of any federally recognized tribe. And they note that you need proof of descendancy and or citizenship. Next slide. Okay, so this tribe, their definition is any enrolled citizen of their tribe, a descendant of their tribe, any citizen of any other federally recognized tribe, any person that's eligible to be a member of a federally recognized tribe, and any other child who's not enrolled but are the stepchildren, half siblings, adopted child living in a native parent or guardian household. And then the last example that we pulled includes any enrolled citizen of a federally recognized tribe and or who has a certificated degree of Indian or Alaska Native blood identification documentation that would be provided from the Bureau of Indian Affairs. Okay, next slide. So we wanted to include a few tips and considerations. So as someone who got to review a large majority of definitions during 2022 submission, We noticed that a lot of tribal lead agencies chose to reference additional information that's not necessary within their definition of Indian child and or service area. So we just wanted to share, for the sake of clarifying with folks, that it's not necessary to share any additional eligibility requirements that you may have. And if in the future you ever want to change your eligibility requirements separate from your definition of Indian child or service area, it will be a much easier process to do that if you don't include this information. So some examples that we saw were references to the service area within the definition of Indian child, references to any potential eligible criteria, such as like a working, training, education status were included in the definition of Indian child. References to neighboring or overlapping service areas or how they coordinate CCDF services with partner tribes. And even the references to the age of children is not required. All of those things are included in separate places within your plan. And again, it's just not necessary, and it could prove to be more helpful to keep them separate if by chance you want to change your eligibility requirements in the future. Okay, next we're going to talk about service areas. So again, let's go to the next slide. Tribes are required to define their CCDF service area, which either has to be on their reservation and or within a close geographic proximity to the boundaries of the reservation, except for those few states where that rule is not applicable. So here are a couple examples that we wanted to highlight. So this tribe chose to set their definition of their service area within a 35-mile radius of their reservation boundaries. Another tribe said anyone having permanent residence on or near the tribe's reservation, and then they define what near means, and that for them means within a 10-mile radius of their reservation. The next tribe listed the local, any permanent residence that's located within the tribe's reservation / county that the reservation is surrounded by, or the communities directly surrounding that reservation, and then they listed out each of the names of the communities or cities. The fourth example is a tribe's reservation, and then they clarify the county and the city that is surrounds their reservation as well. And then the last example is living on or within 60 miles of this tribe's reservation and their off-reservation trust land, which is in close proximity to the reservation. Next slide. So again, I just mentioned this, we don't have to spend too much time. The program instruction clarifies our regulations that your service area has to be on or near the reservation or a reasonably close geographic proximity. There are exceptions for Alaska, California, and Oklahoma. We can go to the next slide. So next we're going to talk about data sources and considerations. So we encourage lead agencies to maintain a record of the data collection process and following written policies and procedures. Tribes have broad discretion in the data sources that they use. It could be federal, tribal, or local data. The data must be valid and reliable. It should align with your definitions of Indian child and service area, and whichever data sources that you use and or approach that you use, you have to ensure that it does not duplicate children included in the count, in your account and in the account of neighboring or overlapping service areas. So with that, we are curious to learn what data sources either you are considering for your child count or that you have used in the past. So we're going to launch a poll. You can choose multiple selections. It's not just one. We are curious in learning all the different data sources that you're considering or have used in the past. These are just samples, and if you have additional data sources that you're aware of, we would love to hear what those might be, and if you could plug those into the chat box, we would appreciate it. So we'll pause here for a few moments and let folks submit their answers, and then we will publish the results. And we'll be sure to include this information in our follow-up email as well. Okay. Please make your last selections and click submit, and then we will share the results. Okay, wonderful. Okay, so a large majority of you all use tribal enrollment data, which makes a lot of sense. Let's see, about 40% use IHS, hospital, clinic, or WIC data. The US Census, a similar amount of y'all use that information. School system data, school district data, Head Start, early Head Start data, tribal vital statistics and census data, Child Protective Services or ICWA data, about 15%, BIA data, about 11%. Okay, great. Thank you. That's really helpful. Again, we'll include these results in the follow-up email as well. All right, let's keep going. Okay, so again, we've talked about ensuring that there's not duplication of child counts quite a few times. It is an important piece to the child count approach. So in effort to make sure that this does not happen, we wanted to show a visual of what both an overlapping service area and or neighboring service area might be. So having an overlapping service area is definitely allowable. Again, we just want to make sure that two separate tribes collecting data on the same Native children potentially are not including the same numbers in their submission. But also Tribe C in this example is not overlapping, but is a neighboring service area. So all three tribes will need to coordinate with each other. And the coordination may look different between the ones that are overlapping versus just neighboring. And so we understand that this process, again, can take a while and can be inherently political. So we encourage you all to start having these discussions now and exploring what this process will look like for you all. And again, this is all tied to your definitions of Indian child and the data sources that you're using for that, as well as your definition of service area as well. Okay. Let's go ahead and go to the next slide.
I had a question.
So, oh, sure.
When you say we have to confer with the other tribes, you mean like we will have to like meet with them and talk to those departments? Is that what you guys mean? Because like I said, this is new and I just want to make sure I'm understanding what I'm supposed to do.
Yes, that's a really good question. So we don't define what confer means, but the end goal, the end result has to, at a minimum, result in not duplicating child count numbers within your submission. So it can look very different across tribes. Some tribes have formal agreements. They have MOUs, MOAs set out, clarifying what data sources you're using, who's going to serve which children, the process for counting out one CCDF lead agency for services versus the other. So it can get quite complex. The Office of Child Care doesn't prescribe what needs to be included in those types of agreements. And again, it varies from nation to nation, whether the CCDF administrators only need to be involved in that communication, whether tribal administrators need to be involved, or tribal leadership. So we encourage folks at a minimum, reach out and make communication with neighboring and overlapping service areas
And
to get this started.
those correspondence, are those documented like amongst like with my CCDF program, like how it was done the year before should be somewhere documented in my office somewhere, like on paper?
So it's possible. Again, OCC doesn't ask for information about that. You're not required to submit any kind of agreements or your written policies or procedures on that or your methodologies, but we highly encourage it. So that would be your question likely to have with your internal CCDF or tribal administrative team. But also the regional office might be able to share about how they supported the previous CCDF administrator. They may have some contextual information to share. So definitely we'll get you connected with your regional office as well if you're not already.
Great, thank you.
So Sarah, we have a question that came in the chat. Do states automatically claim tribal children and families in their child count?
That's a really good question. So states do not do child counts. Only tribes do child counts. However, all tribal children are dually eligible for tribal CCDF through an individual tribal lead agency, and they're eligible for state CCDF services if they meet the eligibility requirements. So their funding mechanism works different than tribal nations. And I won't go into too much detail about the differences. This is different and more complex. Or it's a different set of complexities rather, not more complex. Okay, let's go to the next slide. So actually, this is a good time to hand this over now to our wonderful training and technical assistance partners. Melody?
So good afternoon. This is Selena. Thank you, Sarah. So I do have a couple of slides to cover in this section, which is accessing technical assistance and resources. Next slide. First, there is a one-page brief that covers all of the steps we talked about today. We will put the link in the chat box for you to access. It is a handy reminder as you move through the process. Another resource we would like to spotlight is the checklist, Getting Ready for Your Child Care and Development Fund Triennial Tribal Child Count. This checklist includes conducting your child count and determining your service area. You can follow these checklists to ensure you have completed each step of the process. You could also use the checklist as a part of your child count policies and procedures. We will put the link in the chat box. Once you click the link, the landing page for the document should automatically open. Then just scroll down and click on the blue link and the document should open. This brief offers responses to frequently asked questions about requirements and implementation strategies for conducting a triennial child count. We will put the link in the chat box. Once you click the link, the landing page for the document should automatically open. Then just scroll down and click on the blue link and the document should open. And with that, I will give the time over to Melody to do the closing wrap up for today.
Awesome. Thank you, Selena. And thank you everyone for all of your wonderful questions today. Just wanted to share a reminder that you can reach out. This is the contact information for the Tribal Child Care Capacity Building Center, as well as your Office of Child Care Regional Program Managers. So reach out for support as you think of additional questions. Go to the next slide. All right, so we wanted to share a little bit about a follow-up webinar opportunity. So be on the lookout for an OCC announcement with registration information to come soon. This is a webinar that will be on strategies for developing an accurate, comprehensive, unduplicated child count. This upcoming webinar will provide more in-depth information on identifying key partners, reviewing your current data sources available for use, and conducting your analysis. So be on the lookout and be sure you subscribe to the OCC announcements so you can be sure to get that and get the registration information. Be on the lookout for that. That will be forthcoming during the month of September. All right, so next we wanted to encourage you to think about your next steps as you move forward with conducting your triennial child count. So one strategy might be to take a look at your previous child count, which would have been from the federal fiscal year 2023 to 2025 child count, and consider, what was your definition of Indian child? What was your definition of service area? How many children were in your child count? What data sources did you use? And also locate any written policies and procedures that may have been used to conduct the child count previously. And also identify whether there are any current agreements, like Sarah mentioned, like memorandum of understanding or memoranda of agreement, that might need to be revised or renewed with any neighboring or overlapping tribes' CCDF service areas. And between now and the next webinar, we encourage you to think about the following questions. Do you want to make any changes to your current definitions? And if you do make changes, what might the impacts be? Also, are there different data sources that you'd like to explore? And who are the neighboring or overlapping CCDF service areas, and when should you reach out to them? And we will put a link in the chat box where you can access all of the Triennial Child Count resources. Also wanted to just remind everyone that be on the lookout for a follow-up email. We will be posting these webinar slides and the webinar recording on the TCBC webpage. And so the link that I just put in that says Triennial Child Count resources, that's where you can find all of the Triennial Child Count resources that Selena just mentioned, as well as the links to the webinar and the webinar slides when they're available. So with that, we'll go ahead and wrap up. We're almost at time today. So we just wanted to say thank you so much for taking the time to participate today. We really appreciate it. And again, thank you for all of the questions. Please continue to reach out to your regional office, check out the website and the resources, and we look forward to seeing you in our next webinar. Thank you, everyone. Have a wonderful day.